You've probably seen those ads with really cheap or free Medicare plans that have $0 monthly premiums and include a lot of extra coverage like prescription drug coverage, dental, eyeglasses, hearing aids, gym memberships, etc. And you might be wondering, is it all too good to be true? The truth is that those can actually be the right choice for some people. But if you're not careful, you could end up with huge medical bills or even drive hundreds of miles to see your doctor or to see a hospital. So in this video, I'm going to show you the full truth about the $0 Medicare Advantage plans and warn you about 5 important things that you need to know before you enroll. But first, who is actually paying for these $0 monthly plans? If they're $0, Medicare itself takes the money that it would have spent on you if you stayed on original Medicare, and instead it channels that money to a Medicare Advantage plan or to an insurance company, and then they take over your health care instead of government Medicare. That allows Medicare Advantage plans to offer you extra coverage because they can handle the finances differently than Medicare. They have doctors that they've negotiated rates with, and they have cost control measures to make sure that the guy down the street who wants to go to the ER every time that he sneezes, that some of that is managed. So the other thing that happens is that Medicare, in addition to channeling the money over to the insurance company, they also transferred the responsibility for your health care over to that insurance company that you enrolled into their Medicare Advantage plan. Now you're on Medicare Advantage. You're on private Medicare. You're on an insurance company's version of Medicare instead of government Medicare. So whenever you see a doctor, you have to give them your Medicare Advantage plan card instead of your Medicare card. Now this has several critical implications that you need to know about before you enroll in a Medicare Advantage plan. Because again, it doesn't mean that they're bad. It just means that you need to know what you're signing up for. So here are 5 things that you need to know about a $0 Medicare Advantage plan. Let me lay some foundational groundwork here. Most people are choosing between a Medicare Advantage plan and a Medicare Supplement plan. If you choose to stay with original Medicare, you need something to supplement it because original Medicare by itself is extremely expensive, leaves you very exposed, and you have no maximum out of pocket. You could spend and spend and spend. You know, it's not uncommon for a trip to the hospital to cost $100,000. Well, on original Medicare, that could cost you a fortune, right? So the first thing with a $0 Medicare Advantage plan is that it is more expensive to use it when it actually comes time to use your insurance than it is to use a Medicare supplement plan like a Plan G. But with a Medicare Advantage plan, you have to pay every time that you go. Typically, you will have copays. Let me give you an example of a plan from Los Angeles, California. An inpatient hospital stay is $350 a day for days 1 through 4. If you're in the hospital 1 day, it's $350. If you're in for 4 days, it's $350 times 4. After that, it's $0 a day up to 90 days. With skilled nursing, it's $10 a day days 1 through 20 and $203 a day days 21 to 100. But when it comes to primary care visit, a $0 copay, specialists, 0 for some, 30 for others, an ambulance $265, x-rays $40, emergency care $125. So you get the idea of how a Medicare Advantage plan works. Think of it like the insurance you probably had before you joined Medicare, like your group insurance or your Obamacare insurance. You had to pay when you went to the doctor. You had a copay, right, for your services. Medicare Advantage plans do have copays, but in addition to that, they have limits, which is called a maximum out-of-pocket. Once you reach your maximum out-of-pocket, the plan will take over and cover everything after that. There are some plans with maximum out-of-pocket as low as $500 a year. There are other plans that are $5,000 or $7,000 a year. It depends on the plan, it depends on the area you live in, what's available to you. But once you reach your maximum out of pocket, which is called a MOOP, M-O-O-P, because you know we love our acronyms in Medicare, once you hit your MOOP, then you don't have to pay anymore. Now let's compare that to a Medicare supplement. If you're in a Medicare supplement plan, then generally you have to pay a higher monthly premium, say $150 to $300 a month, but you don't have to pay to see the doctor. You only have to pay one time your $257 Part B deductible. That's the amount it is in 2025. Once you've paid that $257, now you get the rest of your services for free, whether you're at the hospital or the doctor's office, and that's with the Plan G because it covers everything except for your prescription drugs. It covers everything else once you have hit your $257 annual deductible. So a $0 monthly premium plan sounds enticing, but if you're going to hit your maximum, in many cases, you would be better to just pay the monthly premium for a Medicare supplement plan because that's going to be $2,000, $3,000 a year, where depending on the Medicare Advantage plan, if you have an expensive one that could hit a $6,000 maximum out of pocket, you'd actually spend more if you hit your maximum. But the truth is, it's very hard to hit your maximum out of pocket on a Medicare Advantage plan in most cases because it has these little copays and it would take a lot of services to hit that. The area where we see people hit their maximum out of pocket on a Medicare Advantage plan is typically in a situation like cancer. If you're receiving chemotherapy on a weekly basis, that gets very expensive very fast, and we see people hit their maximum out of pocket. But if it's your typical things like going to the doctor, having a knee surgery, having a hospital visit once in a while, having a cold, all of those things, you're just not going to spend that much on a Medicare Advantage plan. So you're likely to come out ahead with a Medicare Advantage plan in that scenario. In a worst case scenario where you have cancer, for that year that you're receiving cancer treatments, you're probably going to come out ahead with a Medicare Supplement Plan G. But again, it depends on what's available in your area. That was point number one. Point number two, and another thing that you need to know about a $0 Medicare Advantage plan, is that usually they have networks of local doctors and hospitals that they work with. And if you go to an in-network doctor and an in-network hospital, you're going to have relatively low cost for seeing the doctor and going to the hospital. However, if your doctor is out of the plan's network, then you may not have coverage at all, especially if you have an HMO plan. HMO, Health Maintenance Organization. An HMO plan requires that you go to your primary care doctor and your primary care doctor refers you to specialists. That's the kind of insurance that almost everyone with a group plan has these days. So it's the kind of insurance you might be used to when you're coming into Medicare. But with a Medicare Advantage plan, just like with your group plan, you can't go to doctors that are outside of your network. Even if they take Medicare, you can say, well, I have Medicare. I want to go to a doctor that takes Medicare that doesn't take my Medicare Advantage plan. The answer to that is no. You cannot do that unless you want to pay the full cost yourself, because your Medicare Advantage plan is not going to cover you out of network if it's an HMO. Now, there is an alternative to that, and that's the PPO plan. PPO is for Preferred Provider Organization. With PPO plans, you have an out-of-network option. Typically, you'll pay higher costs, you'll have a higher maximum out of pocket, you'll have higher copays, but it can open it up for you to go to doctors that are not within the network, but pay more to do that. So that's why it's really critical to understand which doctors and which hospitals are in your plan network before you enroll. If you're not careful, you could find yourself in a situation where you have to drive a very long distance to see the nearest in-network doctor. And let me tell you a real story from my own family. My father chose to be on a Medicare Advantage plan, and it worked very well for him for many years. But when he fell and broke his hip, and he went into the hospital, and my dad lived in a rural area, and the hospital was in his area, that was great. But when he needed to be released from the hospital and needed to go into rehab, there just weren't that many options. We had to drive him almost 100 miles away to go to an in-network rehabilitation hospital. It still worked out, and he had coverage there, and they treated him very well, and I appreciate the staff and everyone there. But for my mother, it was difficult. Dad was now 100 miles away, right? That's a choice that they made, understanding that they lived in a rural area, but they wanted to keep the costs low, right? So if you live in an urban area, though, then there could be plenty of hospitals and plenty of doctors around you, and usually you'll find a lot more in-network options close to you. So rural areas often have fewer options on average. More urban areas will have more options and could be better for the network situation. However, when you compare that to a Medicare Supplement Plan G, where the doctor only has to take original Medicare and now they take your Medicare supplement, you can see why networks can be an unpopular part of a Medicare Advantage plan. Because with the Medicare Supplement Plan G, you just have to ask them, do you accept Medicare? If the doctor, the hospital, the facility takes Medicare, then they also take your Medicare supplement. Okay, up next, number 3, most Medicare Advantage plans require that you get prior authorization before they cover certain procedures. Think of like more expensive things like an MRI or a surgery or something like that. You need to have an authorization from your plan where the doctor shows medical justification, and then the plan will cover that procedure or that test. So check out this example from one Medicare Advantage plan. You can see that if you want a CT scan with this Medicare Advantage plan, you need to present the records from the requesting physician, neurology records, or other specialties that are needed. If you can't provide this, then the plan will deny your request to cover your CT scan. Now, a lot of people throw dirt at Medicare Advantage plans because of prior authorizations. They say that Medicare Advantage companies routinely deny care just because they want more money and because the patient and doctor failed to present what they needed for the treatment. But in reality, the vast majority of requests are approved without any hiccups. And I can tell you anecdotally, from helping thousands of people, we have helped 60,000 people with their Medicare and health insurance decision, that in almost every case case where a prior authorization is denied, it's not actually the fault of the insurance company. It's almost always exclusively the fault of the doctor. The doctor doesn't provide any reason. And think of this as a consumer too. Down the street from you, there's a guy who's a hypochondriac who thinks every time he sneezes, he goes on WebMD and Googles sneeze. What happens when you Google sneeze or go to WebMD about sneeze? It tells you you're gonna die, right? It tells you to go to the ER, right? It's the worst case scenario. So instead of going to his doctor, instead of doing a telemedicine visit, instead of going to the urgent care, this guy jumps in an ambulance, that's very expensive, goes to the hospital ER. Once you go into the ER, they have standards of care they have to follow, and they have to check boxes, and they have to do certain tests. And there is no place that's more expensive to do testing than in the hospital, in the emergency room, right? So that guy down the street is costing you and me hundreds, millions, billions of dollars. Think of that guy down the street aggregated by the number of people who run to the ER for no reason. So people give insurance companies a lot of crap for this because they say you're withholding care. If the doctor provides justification, they don't withhold care. So what I'm telling you is that 99% of the time, based on our experience, when there's an issue with prior authorization, it's because the doctor did not submit the paperwork to the plan. And the plan's looking at it from nothing and saying, look, we're denying this. And they're denying it with a purpose of saying, hey doctor, you need to submit your scans, you need to submit your notes. Tell us why. That's all, just tell us why. If you tell us why, we'll say yes. Medicare Advantage plans get a lot of crap for that. I'll tell you from my experience, it's usually an issue with the doctor's office. But keep that in mind. When you're choosing a $0 monthly premium Medicare Advantage plan, you are subject to prior authorizations. That means that you have to go through those hoops, if you want to jump through the hoops, if you want to call them. You have to make sure that your doctor is submitting stuff to the plan. And honestly, if you have a good doctor, you won't have issues with prior authorization. You could have a good doctor that is good at practicing medicine, but has an office staff that can't handle the administration of it, right? If you have a good doctor in a well-run doctor's office, you're not going to have an issue 99.9% of the time. Okay, let's move on to number 4. One thing that catches a lot of people off guard, every calendar year, Medicare Advantage plans can assess and change their premium. For example, a $0 monthly premium can change its price to the next year to a $10 premium or a $25 premium, or however much that they can justify that they need to Medicare. They could change their copays and coinsurance, their maximum out of pocket. They could change their network of doctors and hospitals. In fact, some of that, the networks, they could change in the year. They don't even necessarily have to wait till the end of the year. They can change their prescription drug coverage. They can change their extra benefits and their perks and all of essentially their copays. So every year around September, your Medicare Advantage plan should send you an annual notice of change document, which we call ANOC, A-N-O-C. It goes over all of your plan's changes for the upcoming year. If you don't like the changes, of course, you can switch to another Medicare Advantage plan in your area during the annual election period, AEP. A lot of people call it open enrollment. The government doesn't. It's AEP. That runs from October 15th to December 7th. And any changes that you make during AEP will take effect on January 1st, which I'm sure you're aware of. So when you see a plan that you like, just keep in mind, you might not be able to keep that plan forever. I see too many people that hold on to their plan and it's no longer good for them. Think of it like a cell phone company. This is an experience I've had that frustrates me. It should frustrate you too. I go into this cell phone company to fix something or to have my phone looked at or whatever, and they say, oh, we just realized you're on an old plan that costs $50 more a month. And if you upgrade to this other plan, your plan will be cheaper or you'll get more of something. It's frustrating to me because I said, well, hey, I've been a loyal customer of yours. Why didn't you just move me to the new plan? Why didn't you tell me about the new plan, right? And a lot of people feel that way about their Medicare Advantage plan because we'll see that you could be with an insurance company. That insurance company keeps their plan. They don't change it, but they start offering a better plan and they don't tell you about it. Years could go by and you're still in that plan that's more expensive, not knowing that they offered a new plan. Why didn't they just change the plan that you were in to match their new plan? Well, because, hey, if you're happy there and you're paying more, then they just leave you. It's terrible, but I see that happen. There's this better plan out there. So you really should reassess your plan every year. Make sure you have an advocate like PlanFit or an independent broker that can review the plan with you every year and make sure that you're in the right one still. Now, contrasting this to a Medicare supplement plan, a Medicare supplement plan never changes their coverage. So you can join a Medicare supplement plan and just stay with it forever. And you don't need to worry about every year, except that you need to think about how much is the premium changes, because the plan benefits don't change, but the premium does increase every year. And in most states, it increases every year for age. In some states, it's just high all the time. Like in New York, they can't rate you for age, and so everybody's paying a high price. In other states, you pay less when you're younger, you pay more as you age. But the coverage won't change. The premiums, yes, they can go up, but the coverage doesn't change on a Medicare supplement plan. And that can be a benefit for some people because you don't need to think about it every year. Okay, finally, number 5. The 5th risk that you need to be aware of with a Medicare Advantage plan is that you might not be able to switch to a Medicare supplement later on. Switching from one Medicare Advantage plan to another is easy. You can do that every year during annual enrollment period or AEP. However, if you're trying to switch to a Medicare supplement plan from a Medicare Advantage plan, you might not be able to do it. Medicare supplement plans, they require medical underwriting after you pass a certain period. So when you first join Medicare, you have 6 months when you can join a Medicare supplement plan, no questions asked. There are some other timeframes too. I have a whole video about that if you want to learn about when you can enroll without underwriting, but you'll have to go through medical underwriting the majority of the time if you want to move from a Medicare Advantage plan to a Medicare supplement plan. Depending on the insurance company, there could be 30 questions, there could be 100 questions, there could be 5 questions. It just depends on the insurance company. And if they see any health condition that they are avoiding, maybe cancer or heart attack, or you've been recently admitted to the hospital or something in the last year or two, they can deny you and say, no, we're not going to cover you. Now, this is not true in every state in the country. Some states have guarantee issue Medicare supplement plans. In those states, Medicare supplements are very expensive. Most states, you have to go through medical underwriting. And in those states, Medicare supplements are less expensive, but the door is closed to some people. Like I said, there are exceptions. There are times when you can move into a Medicare supplement plan, no questions asked. But generally speaking, if you want to switch to a Medicare supplement plan, you'll need to be relatively healthy. So that's a consideration and a downside to Medicare Advantage. You need to know that you want the Medicare Advantage plan, that you're happy with the coverage, you're happy with the network of doctors, you're happy with how it covers your prescriptions before you join. Because if you decide later on that you want to go to a Medicare Advantage plan, the door might be closed for you. Now, despite these 5 dangers that I've covered here, Medicare Advantage plans are still by far the most popular type of Medicare plan. They're not perfect, but a lot of people find that the $0 monthly premium and the addition of prescription drug coverage and the extra benefits make it worth these downsides that I've shared with you. A lot of people on YouTube, however, are just bashing Medicare Advantage plans. The real reason isn't because they're so awful. The real reason is that most YouTube creators know that it's easier to sell a Medicare Supplement Plan G or Plan N because it's hard to sell Medicare Advantage. You have to be certified, you have to go through special steps, you have marketing rules, and they can skirt the marketing rules if they don't sell Medicare Advantage. If you have somebody that only represents Medicare supplement plans, I would turn and run the other way because they're not even required to use some of the phrasing that I've used here, like $0 monthly premium or to be unbiased with you, right? Speaking of this, I did a video that breaks down 3 dangers of a Medicare supplement plan, and you should watch that video next. It's right over here.